So today we're going to talk about the best, oh, sorry. Today we're going to talk about the best practices in creating assessment and measurement. And as you have probably attended the previous online course redesign series in the spring, this one, the best practices in creating assessment and measurement, is the third one, which you see on the screen in bold here. The next one is about how to create engaging learning materials, the best practices as well. I have an orange box on the lower right corner. I want to send you a very quick reminder. Let me send you the chat that, let's see. Okay. Let me send you the chat through the chat. There is a link that goes to the CNU, the website, the canvas that Dr. Malhotra just mentioned about. So what I can show you here is, which is the same. So when you click on that link that I just sent you through chat, it will take you to this. It's ITLE Faculty Learning Community Technology Enhanced Education that Dr. Malhotra built back in 2019. On top of that, I added extra modules. When you click on, go to the left of the screen, click on modules. And then you will see, let me go to the student view. Okay, so when you click on modules, you will see that the academic year 2020 to 2021 faculty learning community. So when you click on that, it will give you a list of the presentations specifically on the distance learning and instructional design in the fall and in the spring. All these are the hyperlinks. When you click on it, for example, like the presentation on presenting, on creating a learner-centered syllabus, when you click on it, you will see the presentation file in PDF format. And then you will also see the Zoom recording as well. And there are extra resources. So let me get back to the presentation. So if you have colleagues that would like
Dr.
to
Wang,
join us.
Sorry, can I quickly request you? As you were showing that, maybe you could also show them the previous one very quickly, since you were sharing.
Oh, yeah.
Thank you.
No problem. Yeah, so the previous one is the same, like here. For example, the last fall, we presented two topics. One is going online, and that should also have the PDF for the presentation file there. And then the same thing. Okay.
And so maybe also we could talk about the one that we did earlier. If you could scroll down, please, to the.
Oh, yeah.
Yeah, I also just wanted to show everyone how there is consistency in all the topics that we are presenting. So some of these topics were also presented previously. If Dr. Wang, if you could click on any one of these, if you could open them, please, so I can show them. So we've had, so that would just be the syllabus. If you could go down to session 1. Oh, the syllabus is fine. That's okay. No worries.
Oh, sorry.
I'll do it quickly. So in the previous session, we had similar topics. Could you scroll down, please? To the actual topic area.
You mean the next page?
Yes, please. Okay, that's fine. Maybe we could go back to the actual. I don't want to take time, but I thought
to the modules.
Yeah. So in the previous sessions, we also covered similar topics, and I think the faculty can benefit from that as well. If you were just to go down to session 1, we have recorded sessions. Likewise, we have the PDFs of the lecture slides of the material that was covered. We also have Canvas discussions that occurred during that time. And these would be about the use of different technology. For example, if you want to use active learning, if you want to use the recording program to make your lectures for pre-recorded lectures, or you want to try out different things such as Edpuzzle, if you could scroll down further, or you want to look at communication strategies for doing them, we have a lot of material that is inbuilt here. So we have slides, we have video lectures, and we sometimes also have step-by-step guides and assignments where you can see what other faculty participated and how they use that. So if you would use that in conjunction with Dr. Wang's current courses, I think that would be an interesting experience. Thank you.
Okay, thank you. So I have seen Dr. Schneider and Dr. Glassman asking about the access. What you could do is that you can contact CNU IT. There's a help desk email that you can contact them and asking them to give you access as a student. Then you can access all these materials, access the course. Thank you. So I'm getting back to the PowerPoint. So today we're going to talk about, you know, the use of authentic assessment, which is the best practices to support active learning, and then identify various types of assessment. And how do we go from now to the use of assessment? So I have a link here that I would like to share with you. And I actually plan to give us the opportunity to talk about this, but I don't think we have the time. So let me grab the link very quick and then share. Okay, 1 second. Okay, so the link is going to an article called "Why Leaders Don't Learn from Success." So you might be wondering, why does this have anything to do with our talk today? So the reason why I'm including this as a article for some self-reflection is that to introduce these three concepts that the ideas that this paper talks about. So we have the roadblocks that to our learning, and what are these three roadblocks? For example, are we making fundamental attribution errors, and are we having overconfidence bias, and do we have ever experienced failure to ask why syndrome? So how does this relate to our course redesign? So think about that, how we're going to shift our mindset from everything is running smoothly, and I think there's nothing wrong to for us to look at. So I think at this point is that how we learn from our success, that things are running well. Let's look at our course. Do we provide the right testing method, and do we ask the right questions, and do we create the valid and reliable measures that really show us that students have mastered the knowledge and the skills? So this is how why I share this reading right here. I keep bringing back this slide is because the Quality Matters, as we all know that CNU is has joined Quality Matters as a subscriber most recently, I believe last year, and to provide the faculty the support and resources for us to use in the course redesign, not just for online, but for blended and as well as for the face-to-face. I have highlighted about 1, 2, 3, 4, and 5 standards here. There are about 8 general standards in the rubric, and these bold highlighted standards are called alignment standards. So last time we talked about learning objective and the competencies, and today we talk about the assessment and measurement and how we are aligning that to support the learning objectives. So what are the best practices in creating and using assessment and measurement? One of the keywords, the buzzwords in education that we probably have seen and heard a lot of times is called authentic assessment. So on the left column, we have the traditional assessments And then on the right columns, we have authentic assessments. So I'm giving all of us probably like a minute to see how these are compared to each other. And then there's some authentic assessment examples. I have listed, included nursing and psychology, and as well as biology and chemistry. Um, uh, I was wondering if anyone in the audience would like to share an example of using authentic assessment in your discipline. Please, first share with the audience that what your discipline is, and then your example of using authentic assessment. Thank you. If I can get two people to share examples, I will show you. I wouldn't call a talent, but some trick at the end of the presentation. Can I get someone to self-nominate?
I can start. This is Andrea Schneider, psychology, and I did exactly that. The case study from multiple theoretical positions. I had a specific case vignette given to the students, and then they separated them into groups, and they had to discuss from a behavioral, psychodynamic, group therapy, all the different theoretical approaches, putting themselves into the shoes of the idea of the theoretical position of therapy, and then discussing the case based on that. And it was very productive.
Thank you very much. And I really look forward to, I think we all probably look forward to seeing your presentation coming up in May. And who else would like to talk about your authentic assessment example?
So then I had a check-in with the students about their discussion, and had them, from their discussion point, evaluate each other what they thought about their theoretical presentation. So it's not just my evaluation, the assessment of the performance, but also the students themselves, the peer level assessment that I included.
Yeah, that's really sounds very engaging. I did a research project years ago. It's called CPR, Calibrated Peer Review Project, and then use the tool for students to self evaluate and then to peer evaluate. And it's a very and then we did the research study across 2 semesters that proved that increased their students' critical thinking and their writing as well. Thank you for sharing, Dr. Schneider. So let's go to the next slide. So here are the authentic assessment definition according and best practices as well, according to Grant Wiggins, which is also a big name in education. So I'm presenting one by one slowly. Okay, so now we have seen some of the definition of the authentic assessment. And the next activity I would like to have us to do is that sort of like a guessing game. Okay, so this game is called a typical versus authentic test. And I have the typical tests, authentic tasks, and then the indicators of authenticity. But I have one of in each row that's covered. So can you take a guess of that cell that is missing the information? So for example, the first row, right? And let me first reveal that. So I have. Okay, sorry. So the first row, I have the typical test, which requires correct responses, but then the authentic tests require a high quality product or performance and a justification of the solutions to problems encountered. And then I have the indicators. So, so for the second one, I have second row, I have the authentic tasks already spelled out, and then the indicators. Anyone who would like to take a guess of what is the corresponding typical test for that one that is covered? don't be afraid of making mistakes or not being exactly the same. This is not a test. Anyone who would like to try? No one?
Perhaps there's no study guide, so you're
Yeah.
not sure what to study.
Yeah, I just revealed that the second answer, which is the not the answer, but the second, the matching, which is must be unknown to the student in advance to be valid. So as you see that the authentic test should be known in advance to students as much as possible. The third one.
Can I, sorry, ask you a question about, since you used the word valid there, in terms of traditional versus authentic tests. I know that there's a number of faculty, actually had this conversation recently with some people in the forming College of Dental Medicine, seem to want to use more traditional tests because they're more reliable. In other words, you're asking every student the same question. When you go to more authentic tests, you have variable situations they're in, and one student might be in a more difficult situation than another. And so in my view, what they're doing is trying to emphasize reliability over validity of the results of the test. And there's the trade-off. A very structured test with everyone's multiple choices, it can be very reliable. You get the same answer every time, and it's very clear what the answers are. Where authentic tests, more ambiguous real-world situations. So you say something about this trade-off between reliability and validity of assessments.
Yeah, Dr. Glassman, you raised a good point. I think authentic test does not oppose the use of, for example, well-structured, designed multiple choice tests. I think it just gives a different perception about what else can we do and to measure different types of, for example, learning objectives, right? Okay, so I'm going to reveal the one that's coming up. Okay. Okay, I will address some of the questions that's coming up in the chat. Okay, so the next one, the typical tests contain items that isolate particular skills or facts, but then authentic tests are integrated challenges in which a range of skills and knowledge must be used in coordination. So we can see that if the items, the test items that are isolated in the isolated fashion, created in that fashion, and then they might not be provided the valid and reliable measures for our design purpose. So the next one, I'm going to reveal both. This is how typical tests and authentic tests and the indicators of authenticity when the typical tests include easily scored items, right? And one shot, students get one chance to show their learning. I must say something about I actually have been in two PhD programs, one in the University of New Orleans, the other is the Texas A&M University. And when I took educational statistics, the 600 level, and I ran into this situation, taking multiple choice tests, then lots of the items are very one shot. And then after finish the programs, I did not use much of the knowledge and the skills until later when I was in my job actually allowed me to use all the skills and knowledge about the statistics, educational statistics, and when I conducted the program evaluation. So when I looked back at that point, I realized that, well, how learning should have been applied to real world situation, giving me a case to collect the data and analyze the data, and then to interpret the data, and then how we refine our design and critique our design. But I don't think my experience gave me that, enough opportunities to really deepen my knowledge and skills. So that one is typical, right? The typical test is just provide the score, but authentic tests provide a usable diagnostic information about students' skills and knowledge. This is, again, about how we compare the typical tests and authentic tests. I don't think there's, wrong about the typical test, but it's how we can make it, different, how we can make it more reliable, like Dr. Glassman just mentioned, and reliable and valid, and also how can we use the test or different types of tests to measure different skills at the different levels in the knowledge. One thing that I want to bring this back, that I did look at after every workshop, I did review the comments. For example, what future topics that you would like us, the ITLE, to offer. And I did go through the qualitative feedback there. And one of the attendees from the last presentation mentioned about what is the research behind all these advocated best practices. I want to show you the QM rubric that I'm showing you here. This is the QM rubric that I keep using as the reference to create my presentation. And this is the 6th edition. So the very first edition probably came around 2006 or 2007. And I was the research colleague for Quality Matters for 2 years. I was invited to be in the research team for the rubric. So this rubric was actually developed, not by me, but I was, for the later version to inform the development of the revision of the rubric. And the rubric was created based on a rich body of the full literature in education, and then instruction design theories, principles, and as well as best practices. And if you are interested in the research behind the rubric and how the rubric has been informed by the research, I would recommend that you go to the website, which is the QM Research Library. I can take you there right now. And this is the link that I just shared with you, goes behind that graphic. Goes to the Quality Matters, and then if you click on the Research tab on the top, you can see that this is you can go to the QM Research Library. When you click on it, and you can see that this is for you to find the research that shows that shows the research studies that are related to one specific standard. So for example, if you are interested in standard number 3, which is what we are talking today, assessment and measurement, right? And then the publication date, let's just put from until now. And then maybe 20, okay, let me forget about that. So if okay, so let me get back to the 10 years, okay? And then let's search standards, and nothing is found. That's kind of odd. Okay, I don't know what happened. Oh, okay, I see that. 20. Okay, I don't know why this is it's not allowing me to change to the 20. Okay, there it is. And then click on search standards. Now you can see that here is the list of all the research that has been identified by QM that shows how they're related to the rubric, and then the rubric that has been refined based on these research studies. And there are multiple pages you can see from the bottom, and then you can export this as a PDF or Excel. Okay. So our presentations are based on these research studies and the best practice and instruction design theory as well. Just for your information. And then let me see get rid of the window. So how do we take the actions from this point, right? So number one, we have the QM rubric, And let's go to the rubric standard 3. And then we're going to make holistic changes and then use the QM rubric standard 3. Again, to see if we are staying consistent with that standard. So again, like we mentioned about this concept last time, that when we redesign our courses, no matter it is for just the face-to-face or hybrid or the purely online, it doesn't really matter, that this concept of alignment is applicable to every modality. So we have the vertical alignment, which is our course level, our module, weekly, or unit level learning objectives or outcomes support course level and then program level learning outcomes. And then for the horizontal alignment, which is every week, every module or every unit, depending on how you organize your courses, that all these components like assessment, activities, materials, and the technology support each week's learning objectives or module objectives. Okay, so so this is the rubric standard number 3. However, because that I really like working with the faculty, and I have taken the this workbook to FedEx, and I have created a PDF file of that specific standard for today's presentation. So please let me know that you are able to open the document that I just sent to everyone. And if you can confirm that, that would be wonderful. Okay, thank you. So I actually have designed a activity. However, I realized that I'm not able to create the breakout rooms. Okay. So okay, so so what I'm asking you for your participation is that could you please open that document that you I just sent you, which is the QM standard 3, right? And then can you just pick one standard? There are 5 sub standards in that. So let me click on that one, that document. And you will need a magnifier for this activity. Just kidding. So for example, pick one standard. We have 3, right? 3.1, 3.2, 3.3, 3.4, and the 3.5. Okay. So could you please just choose one standard and then go through that annotations? And can you share back with the group about after you have read that specific standards, tell me how you feel about it. What are the things that you are doing right now? And then what are possible changes or some new ideas that have inspired you? I'll give you probably a few minutes. So anyone would like to share? My offer is still valid. If I can get to have a few people talk about their own standards that they have chosen, I will show you a trick at the end of the presentation, which is very interesting presentation. It's a good trick that we can do at the parties. (3.1) standard, anyone? Okay, Dr. Fried shared about the emphasis, the 3.2, she said she really appreciated the emphasis on the student perspective and understanding of the grading scheme. Okay, and what else? I think Dr. Glassman asked everyone to share their opinion about, let me see, the thoughts about, Dr. Glassman, do you mind, um, just because I'm afraid of misinterpreting your questions, do you mind asking directly? Thank you.
Well, sure. No, it was just really, I don't want to be redundant. It was the point I was raising earlier, which was there was a post by Ashim that I was responding to in the chat. He's bringing in the idea of thinking about Bloom's taxonomy. And the point I was trying to make earlier, as you move higher up in Bloom's taxonomy and you're looking at things that are more creative or integrative skills, that the point I was trying to make is I think inherently you have to relax about having reliable assessments. You can't give a completely reliable assessment if you're measuring real world authentic activities. That the real world is messy, people are in different situations. Each student's not going to be faced with the same real world situation. They're not going to respond exactly the same way. So you have to not be so concerned about reliable assessments if you're going to have valid assessments. If you're trying to measure highly integrative creative skills and you're trying to be highly reliable about it, they're not going to be valid. That's the point I'm making.
Anyone would like to share their comments or ideas?
I agree that you can have issues with the reliability, but even if you do have different creative questions and you're working in those real world situations that students may have different reactions to, you could have a core set of principles or a core set of information that they would need to achieve. And that would give you that sense of reliability, at least for that core section. And then the rest of it would definitely be shifting from student to student, but at least you would have a set of reliable data points to work from.
Yeah, and I wasn't trying to make the point that you can't have any consistency among students or assessments or situations, but that if you try to overemphasize reliability at the higher order skills, you're going to be losing validity.
I think that's an interesting. I just wanted to add. So I think that's quite an interesting discussion, because I think in terms of reliability and validity for health professions educations, that's why multiple health profession educations are now moving towards a dichotomy where they have like a standardized test format where they can actually test their questions as pre-test questions when they give them out to a national audience. They can collect data, I think, for validity for those questions and the question performance, try to see how well they continue to perform on Bloom's taxonomy and other tags. But then the second step is probably like a skills-based assessment. So I think what Dr. Glassman is saying is very interesting, because for a skills-based assessment, like for a dental medical program, for a pharmacy program, for a medical program, the skills-based assessments are even more difficult because they need observation, they need continual guidance. And I think that's why probably the diversification into OSCE type examination settings, where the modality of testing is very different from, say, a specific multiple choice question. So I think it's an interesting problem. I just loved hearing the discussion.
And I would just say that and not to prolong this, but even an OSCE is not a completely authentic evaluation. Really, if you want to do authentic, you watch the students. You're talking about health professions. You watch them interacting with patients in a real world situation, and you see what they do. And of course, each one of those situations is going to be different. Each patient's going to be different. They're going to have different conditions. There's different things, and so you have to. It requires faculty judgment to be able to look at that real world interaction and decide, did they meet the criteria, or did they handle that the way you thought? And there's no way to have that be a completely reliable for each student to have exactly the same situation to deal with.
I think the interesting point is that I agree with you. I think that's the point I was trying to make. You know, I think if you look at Miller's pyramid that talks about going from learning to actually doing, and that's kind of like the backbone of Bloom's, became the backbone of Bloom's modified Bloom's taxonomy. I think that becomes very difficult to do in a real life practical setting. So I agree with you. The reliability goes away to some extent. But I think for standardized national exams, perhaps another approach could be like a statistical testing of the question to see whether it's how authentic on that scale of validity, and you know, maybe you can actually have somewhere in the middle between what you and Dr. Fried are saying, depending on what the exam is testing.
Well, absolutely. And it depends on what you're doing. So if you're trying to, you know, decide in the beginning biochemistry course, did the student memorize all the facts? That's one thing. But if you're trying to decide, is this student ready to go out and practice their profession at the highest level right before they graduate? It's a very different situation.
True. What do you, you have the mic here. Do you mind sharing your insights about the 3.4 that I'm showing on screen? The assessments used are sequenced, varied, and suited to the level of the course.
You're asking me that, Lee?
Yes, please.
Oh dear. So now I've done it right. Put myself in the spotlight. Well, I think actually this will just be repetitive of what I just said. I think the assessments have to match where you are in the learning process. That at beginning level, lower levels of objectives in Bloom's taxonomy, you're going to use more structured, reliable exams that are going to be testing memory and testing recall and testing some application of the facts to a made up situation. But as you move up in the educational program, and as you get to really wanting to decide, is this person able to practice independently in their profession, then you have to move to much more authentic valuations if you're going to actually have some sense of that, and that by nature becomes more variable and requires faculty judgment to interpret, whether it's not just a matter of putting it into the Scantron machine and seeing what score comes out. It takes faculty judgment to decide, did the student in that situation do the appropriate thing? Did they have the appropriate background? Did they consider all the things they needed to consider? And so you can have rubrics about the kind of things that students should do in that situation, but ultimately at those higher levels, it requires faculty judgment to decide. There's no absolute formulaic way to do that.
And I actually I'm just very stoked. I'm trying not to interrupt the conversation. I'm very stoked by what Dr. Glassman said. So I think another aspect of that is to take a look at the, excuse me, is to take a look at the choice of teaching modality. So, you know, for example, if someone is using problem-based learning, right, or someone is using team-based learning, or they're using different kinds of modalities for teaching, I think as you go up the Bloom's taxonomy and as you go into practice, particularly in the health professions educations, those kind of pedagogy techniques lend themselves to a certain degree of, you know, rubric design, of validation of the rubric, and kind of going exactly with where Dr. Glassman is going. But it becomes very difficult to validate each and every step that someone is doing. But, you know, I think I want to share something very quickly. So, for example, from the perspective of interprofessional education, now you have you know, a lot of guidelines that are coming out, and this is completely practice-based. You have core competency documents that can be validated for each of the activities. So perhaps one way of doing this for higher Bloom's taxonomy, point 3.4 that you were sharing, Dr. Wang, the type of assessment could match with the teaching modality. I think you know, and also perhaps, you know, one could take a reductionist approach and break a large complex problem into smaller pieces. Those pieces may fit into a validation rubric much better than a complex whole. I don't know, just some thoughts.
Thank you. Really, I really appreciate your Dr. Malhotra and Dr. Glassman's your thoughts and especially tying your point of view to the real world, you know, teaching example, because I think that's what makes the instructional design presentations more effective, because I can present all the best practices from the education point of view. However, your real world examples really make this more meaningful discussions, and have faculty, other attendees will have more takeaways, you know, from this. So really, thank you so much. So let me go back to my presentation. So, okay, so I'm going to share with the workshop evaluation again. Let me go here. Okay. Okay, so this is pretty much the end of the presentation for the day. If you could please take just probably take less than 2 minutes. Yeah, could you please go to that Google form and to tell us what are the things that are interesting that we discussed today, and what are the things that you wish that have been covered, and then maybe something that you might be interested in presenting, with ITLE some in the future. I think that would be wonderful. Any ideas? Let me get back to the presentation. Yes, so and I do have some questions that from my conversations with other faculty before, prior to CNU, that after this presentation, people ask, can I still use multiple choice tests? And I say, of course, yes. Multiple choice tests, they do provide effective measures, so ways to test a certain knowledge, certain levels of knowledge, right? And then however, there is some how to say that terms behind it, how we can create valid questions to ask the right questions, right? And I and there are pros and cons that we need to realize that behind the multiple choice test. And I found a very old book. It's called Science Teaching Reconsidered, and chapter number 6. It talks about the testing, and I think it's very interesting. So let me see if I can share that link with you or no. Okay, so I'm sending you that. However, if you are not able to open that PDF file of that science teaching reconsidered, like I said, ITLE always shares this information through Canvas, the course that earlier we demonstrated. So hopefully you will be access all the materials from there. So that's pretty much the presentation for today. And I realized that all our faculty and admins, you have been jumping from one meeting to the other. So I have thought about how we can make our meeting less condensed, but more having more meaningful discussions. So right now I have taken a slightly different approach so that we can save our time, and then we have Canvas, right? And we can always have discussions there, and we have extra resources just in case that we have not covered enough, or you have some extra resources that you would like to suggest, please send it to us and we can share and upload it there as well to really create a virtual faculty learning community there as well. As I promised, and earlier I said if I could get more than 2 people to discuss and talk about, then I can show you the techniques that I keep bragging about. Okay, so this is the technique that, can you see what it is? Okay, when I play, you will know what it is, okay? And please don't laugh, because this is really first time I've done this in front of an audience. Oops, sorry, I'll take another 3. This one, they are softer. Okay, so that is the technique that I learned. It's juggling, obviously. And how did this relate to our course design? So so I actually learned this trick starting from the first one. Just feel it. And then I add another one, which is the second. And then I added 3 altogether practice. It took me about 7 days, 6 to 7 days to learn this. So how that relates to our course redesign, I think it's, again, we do focus on one thing at a time. And then as time goes by and we have more and more add on to it, and then things will look a lot differently in the future. So just want to share some of my personal learning experience outside the classroom so that you can get some cheerleader type of action from me that for the course design that doing little by little, and then you will find it's such a rewarding process in the end. Thank you so much. That's the end of my presentation. So if you want to stay, share something extra, please feel free. Oh, another thing that I want to share, I almost forgot, but which is good. Okay, so I received a received some email today talk about from the Chronicle of Higher Education. So it talks about the upheaval in 2020 after the whole world were hit by the pandemic, and then it asks about what's coming in 2021, and then it talks about the trends report. So let me share that link with you if you have that. I hope that that's a valid link, but it's very strange. It's a long link. Yeah. Thank you so much. Yeah, so think about last year that we during the pandemic after the pandemic hit us, and then everything just went online, and then how we're going to handle this after students come back. Is everything going to be the same? How we're going to adjust our teaching and the learning to the new, maybe new modality maybe. But one thing we're confident is that nothing is going to be the same as we used to. So how we're going to deal with that. So thank you so much again for participating. I will stay here until 4 o'clock just in case that you have questions.
Thank you, Dr. Wang. Wonderful talk.
Well, not me. I think it's the wonderful discussions from everyone who has
Sure.
contributed. Yeah.
Yeah.
Thanks, Todd.
Thank you, everyone. Have a great day.